The question is that the House is now adjourned. I call the honourable member for Lawler.
Thank you, Madam Speaker. For over 30 years we've had universal health care, the core of which is every Australian's capacity to see a GP and have x-rays, blood tests and imaging without the need for cash on the day. It is the cornerstone of our healthcare system that primary care is easily accessible. How do we do this? Through a Medicare levy paid by taxpayers. These services have not and are not free, as asserted yet again by the Minister for Health today in question time. And those who use bulk billing services are not a burden on our economy. And what will it mean, Madam Speaker, if this GP tax becomes a reality? It will mean families will have to find the cash for primary health care costs every time they go to the doctor or have follow-up tests. And it's bad enough that this government thinks that that is okay. But they also fail to understand that this will mean families make choices that may mean worse health outcomes and a longer-term, more expensive treatment. Or do those opposite fail to understand? Madam Speaker, I think they understand too well what this means. They know it will undermine Medicare. They know it will change the business model for GPs and be the end of bulk billing. Just as they know that starving the public hospital of recurrent operating costs will undermine the system, and cancelling preventative health programs will lead to higher costs and worse health. Madam Speaker, the people I represent in this place and I struggle to understand the rationale behind these measures when the so-called budget emergency argument has been shown to be a furphy. There is, however, an emergency developing, a health funding emergency. We have a health funding emergency and a health minister emergency. We have a health minister that doesn't seem to take advice from those professionals delivering health services on the ground. And worse than that, one who won't take the time to listen. Madam Speaker, I heard yesterday a story that demonstrates this lack of listening, that paints a picture of a minister who lacks empathy. I heard this story from a resident who has a small child suffering from cystic fibrosis, who is, like others around the country, waiting for the outcome of the Pharmaceutical Benefits Advisory Committee process to see Kalydeco available under the PBS. Understandably, parents whose children are set to benefit from receiving this treatment are anxious for approval to be granted as soon as possible. These parents understand the approval process. They know that the minister has no role to play in the process, but understandably they cannot do nothing and just wait. So they are doing what any parent would do when faced with these circumstances. They are engaging in the process through any avenue possible. These parents have been running an awareness campaign, visiting electorate offices to talk to their members of parliament, visiting Canberra, writing letters, appearing on TV and being active in social media. Naturally, this includes engaging or trying to engage with the health minister. And what is the health minister's response? Does he engage with them on social media? No. And even worse, he deletes their postings and blocks their access to his Facebook page. As a local member, I've also taken time to try and engage the health minister and found a similar response. Letters go unanswered for months. Requests for meetings are not followed up. And as a result, the brand new Catherine McCauley Rehab Centre in the Werribee Mercy Hospital and its need for recurrent funding is ignored. Madam Speaker, I have to ask, what does this minister do with his time? The only time he bobs his head out from the sand is to announce a new health tax or a new health cut. This is a minister prepared to destroy our world-envied health system, cut hospital funding, increase cost to patients and cut preventative health programs. All these measures placing an added burden on family budgets and on the longer-term health costs of the country. The Kalydeco families, the local GP that wrote to The Age today, the Werribee Mercy Hospital, the seniors I met with last week, the families and pensioners responding to my community survey, the 30,000 people who marched in Melbourne the other Sunday, all know the value of our current Medicare health system and want to defend it. I implore this minister to get a heart, to start listening, to act in the interest of Australians.
The question